Around a dozen concerned Niagara residents gathered outside of Port Colborne's urgent care center this morning, calling on the government to reverse its decision to close the center on holidays and every Saturday in the summer. Emily Taylor joins us live in studio with the details. Emily.
Well, Kelly, Niagara Health announced its new summer hours recently, saying the closures are due to a lack of doctors and nurses in the region.
What you have is a sort of death by 1,000 cuts.
That's how the chair of the Niagara Health Coalition, Sue Hotte, described the rolling back of services at the Port Colborne Urgent Care Center, which is closed today. Niagara Health announced even more reduced hours in June, saying the Port Colborne Center will now be closed every Saturday until September, in addition to closures today and Labor Day weekend.
This puts an incredible stress on our residents. We know that more than 50 people every day use our urgent care.
Douglas Memorial Urgent Care in Fort Erie will similarly be closed every Friday until the end of summer, as well as the civic long weekend August 1st to 4th. The Fort Erie Healthcare SOS group says they found 114 people use their local care center on an average Friday, the day the UCC will now shut its doors,
which would drive 114 people into the emergency room. And they say that the emergency is already overburdened.
It's around a 13-kilometer distance between Port Colborne Center and the nearest emergency room in Welland, a distance that can be a challenge for seniors or people with mobility issues. Niagara Health says the summer closures are due to a critical shortage of available physicians. These changes are a measure of last resort necessary to preserve safe 24/7 operations at emergency departments in Niagara Falls, Welland, and St. Catharines. The healthcare organization says they're facing a shortage of 111 physician shifts this summer, more than half of which are at an emergency department in St. Catharines. Today's demonstration follows comments from last month from Premier Doug Ford, who was asked if the government has a plan to tackle the closures.
Well, first of all, it's always very concerning, but these are summer hours and we can't get the personnel. That's what it comes down to. If I had doctors and nurses all over the place, yes, that's not a problem at all.
Niagara Health is planning to fully close these urgent care centers in Fort Erie and Port Colborne after construction is finished on the new South Niagara Hospital. It's expected to open its doors in the summer of 2028.